Warning: never eat almonds if you have these 7 symptoms hiding in plain sight. If you're 60 or older, listen closely, because a handful of almonds that seems harmless could be quietly making an existing health issue worse. I'm part of the Ageless Vitality community, and today we'll walk through 7 clear symptoms to watch for, why almonds might be the trigger, and what to do next. Stay with me until the end for safer snack swaps and practical tips. Do you eat almonds regularly? Before we go on, tell me in the comments, have you ever felt odd after a few nuts, tingling, bloating, or fatigue? I'd love to see your experience. Here's the roadmap. I'll name each symptom, describe what it feels like in plain terms, explain in one sentence which almond compound is most likely involved, and give one practical action you can take. I'll also point out when a sign is urgent and needs immediate medical attention. Everything I say is framed carefully. Almonds don't cause these conditions outright for most people, but they can be a trigger or aggravator for vulnerable seniors. If anything here sounds familiar, please check with your healthcare provider before changing your diet. Before we begin, a clear note on mapping. I'm turning 5 medical categories into 7 viewer-facing symptoms so you can actually spot trouble. 2 symptoms are split out from the same underlying condition. Nut allergy is presented as both oral tingling and throat lip swelling, and digestive disorders are split into chronic bloating and constipation or irregular stools. At the end of the list, I'll show you exactly which symptom came from which medical category, so there's no confusion. Symptom 1: tingling or itching in the mouth right after eating almonds. If you bite an almond and your tongue or the roof of your mouth starts to tingle, itch, or feel slightly swollen, that little prickly feeling is meaningful. It often points to an oral allergic reaction to almond proteins such as almond. For older adults, even mild allergic signs deserve attention because immune responses can be unpredictable with age. Action: stop eating almonds and note how long the sensation lasts. If it's brief and mild, contact your primary care provider or an allergist to discuss testing. If it progresses toward breathing trouble or throat tightness, seek emergency care immediately. Experts from the American College of Allergy, Asthma, and Immunology remind us that allergies can escalate, so don't shrug this off. Symptom 2: lip, tongue, face, or throat swelling, tightness in the throat, or trouble breathing. This is the most serious one. If your lips puff up, your tongue feels large, your face swells, or you get a tight, squeezed feeling in your throat after eating almonds, that can be a sign of anaphylaxis. Anaphylaxis is a severe allergic reaction that can come on quickly and affect your breathing and blood pressure. Seniors should treat this as an emergency. Call for immediate medical help or go to the nearest ER. Do not wait. If you have a known nut allergy and carry an epinephrine auto-injector, use it per your provider's instructions and follow up with emergency services. Almond proteins like almond are established allergens and can trigger these dangerous responses in sensitized people. Symptom 3: recurrent sharp back or side pain or blood in the urine, especially after eating nuts. If you notice a sudden severe ache in your flank, the area between your lower ribs and hip, or you see blood in your urine after snacking, that pattern can signal kidney stones or irritation related to high oxalate foods. Almonds are relatively high in oxalates, and for people prone to calcium oxalate stones, a large intake of high oxalate foods may raise the chance of forming stones. Older adults are more likely to have reduced kidney function, which can increase risk. Action: seek medical evaluation if you experience sharp urinary pain or visible blood in the urine. Tell your clinician about your almond intake. They may recommend urine testing or imaging. Stay hydrated. Drinking more fluids is a low-risk practical measure while you arrange care. Symptom 4: persistent bloating or excess gas after eating almonds. If you regularly feel your belly swell, hear a lot of gurgling, or have uncomfortable gas after nuts, that's a red flag for a digestive sensitivity. Compounds in almonds such as tannins, lectins, and phytic acid can irritate the gut or feed gas-producing bacteria in people with sensitive bowels. Seniors commonly experience slower digestion and changes in gut flora, which can make this discomfort worse. Action: reduce or stop almonds for a couple of weeks to see if symptoms improve and report this to your healthcare provider. If you have known digestive conditions like Crohn's disease, inflammatory bowel disease, or severe irritable bowel syndrome, consult your gastroenterologist before reintroducing nuts. Symptom 6. New or worsening constipation or unpredictable bowel movements after eating almonds. Some people respond to almonds with slower gut transit or irregular stools. For others, phytic acid and the fiber structure in whole nuts can be hard to process, particularly if chewing is reduced or saliva production is lower, which is common in older adults. If you find that almonds consistently lead to harder stools, straining, or alternating constipation and loose stools, it's worth investigating. Action: talk with your clinician about bowel habit changes. A short trial removal of almonds while keeping other fiber sources stable can help identify whether they play a role. Do not self-prescribe laxatives without consulting your provider. Symptom 6. Unexplained fatigue, persistent brain fog, or gradual weight gain that worsens after eating almonds. If you feel unusually tired, fuzzy-headed, or find that your weight creeps up without other explanations, and you notice this pattern in connection with almond consumption, consider thyroid-related interactions. Almonds contain goitrogenic compounds and are also relatively high in polyunsaturated fats that in some contexts may influence thyroid hormone metabolism or the absorption of iodine and other minerals. Older adults are already at higher risk for thyroid dysfunction, which can present as fatigue, memory lapse, slow thinking, and weight gain. Action: mention these symptoms to your doctor and ask whether thyroid function tests are appropriate before changing medication. If a food-related pattern is suspected, an elimination trial under medical supervision can be helpful. Symptom 7. Worsening joint pain, persistent skin rashes, or autoimmune flare-ups after nuts. If you notice that joint stiffness or pain flares after eating almonds, or that eczema, dermatitis, or other autoimmune-type rashes worsen, this can be a sign that nuts are aggravating an inflammatory or autoimmune condition. Almonds contain lectins, phytic acid, and are relatively rich in omega-6 fats. In sensitive individuals, these compounds can potentially fuel inflammatory pathways or interfere with mineral absorption that supports immune balance. Older adults with existing autoimmune diseases may be especially vulnerable. Action: keep a symptom food diary and bring it to your rheumatologist or dermatologist. Do not stop essential medications on your own. Instead, review dietary patterns with your clinician to see if trialing a nut elimination might reduce flares. A short pause to emphasize medical safety. At every step, these signs are potential signals, not proofs. When I say may or can, I mean almonds are a plausible trigger in vulnerable people. A study in Nutrients and other reviews cited by researchers in MDPI and Science Direct discuss how almond components, oxalates, amidin, lectins, phytic acid, and high omega-6 can plausibly aggravate these conditions in susceptible individuals, but individual testing and clinical guidance are essential. Now let's make the mapping completely transparent so you can see where each symptom came from and which two symptoms were extrapolated from single categories. This is important for clarity and for discussing your situation with a clinician. Nut allergy split into symptom 1, oral tingling or itching, and symptom 2, lip, tongue, or throat swelling, breathing difficulty. Kidney stones, high oxalate, split into symptom 3, recurrent flank or back pain or blood in the urine. Digestive disorders, IBS, Crohn's, or leaky gut, split into symptom 4, chronic bloating or gas, and symptom 5, constipation or irregular stools. Thyroid dysfunction split into symptom 6, unexplained fatigue, brain fog, and weight gain. Autoimmune disorders split into symptom 7, worsening joint pain, skin rashes, or flare-ups. I split allergy into 2 symptoms because oral itching and full-blown throat swelling are both clinically meaningful but differ in urgency and implications. I split digestive disorders into bloating and constipation because those are distinct, observable complaints many seniors report after certain foods. If any of these symptoms sound familiar, please take them seriously. For the allergy-related signs, act fast and seek emergency care when breathing is affected. For kidney stone-type pain or blood in the urine, get medical evaluation promptly. For digestive, thyroid, or autoimmune concerns, document your symptoms, note patterns tied to almonds, and arrange a clinical assessment before making long-term dietary changes. Now, a short emergency checklist you can remember: throat tightness, hoarse voice, difficulty swallowing, sudden breathing problems, lightheadedness. These are urgent. Call emergency services or go to the ER. Mild mouth tingling is not the same as anaphylaxis, but it should prompt a medical appointment and possible allergy testing if it repeats. Let's shift tone briefly to reassurance and balance. Almonds are not a villain for most people. For many seniors, they are a nutrient-packed snack with concrete benefits when tolerated in moderation. Research and clinical summaries highlight several potential upsides that matter to older adults. Brain health support. Almonds provide vitamin E and healthy fats that some studies link to cognitive support when part of an overall healthy diet. Skin repair and antioxidant support. Vitamin E and micronutrients in almonds help protect skin cells from oxidative stress, which can be helpful as skin thins with age. Sleep and mood support. Magnesium and B vitamins present in nuts can help with sleep quality and mood in some people. Red blood cell and circulation support. Iron, copper, and folate contribute to healthy blood cell maintenance. Muscle repair and strength preservation. Plant protein and key minerals help seniors maintain muscle mass when combined with resistance activity. If you tolerate almonds, the conservative guidance echoed by nutrition experts is about 1 ounce per day, roughly a small handful. That portion size offers nutrients without excessive calories for most older adults. Keep portion control in mind because weight balance becomes more sensitive with age. If you identified with any of the 7 symptoms or have a condition that raises concern, here are practical, low-risk steps you can take right away. Stop eating almonds for 2 to 4 weeks while you track symptoms. Maintain other balanced sources of nutrients. Keep hydrated, aiming for regular fluid intake since fluids help prevent kidney stone formation, and schedule a visit with your physician, allergist, or gastroenterologist to review symptoms and testing options. Now, what about safer alternatives? If almonds are a problem for you or you want variety, consider these options while consulting your clinician. Walnuts, lower in oxalate than almonds and higher in anti-inflammatory omega-3s, which may be gentler on joints for some people. Macadamia nuts, low in polyunsaturated fats and often easier on digestion for those sensitive to omega-6 heavy nuts. Pumpkin seeds, pepithas, a seed option with a different nutrient profile, good for magnesium and iron with generally lower oxalate content. Sunflower seeds, a seed choice that can supply vitamin E without the same oxalate load as almonds. If you have nut allergies, move to seed-based, but check cross-reactivity with your allergist. A few practical kitchen tips, conservative and safe, that can reduce digestive irritation for many people. Chew nuts thoroughly. Try smaller portions or ground nut butters if texture is an issue. And note that soaking or roasting may reduce some bitterness and make nuts easier to digest, but don't assume soaking removes all anti-nutrients. If you try modifications, do so cautiously and with guidance if you have a sensitive gut, a history of kidney stones, or thyroid issues. Hydration matters. For anyone with a history of kidney stones or reduced kidney function, drinking adequate fluids throughout the day helps dilute urine and lowers the concentration of substances that form stones. If you're taking diuretics, have heart failure, or have fluid restrictions, follow your clinician's fluid plan. Do not change fluids on your own. A few frequently asked questions I get from our Ageless Vitality community. Can I switch to almond milk or almond flour instead? Answer. Almond-based products vary widely in almond content. Some almond milks are very dilute, almond flours are concentrated. If you react to whole almonds, approach processed almond products cautiously and discuss with your clinician. Food processing can sometimes change how an ingredient affects you, but it does not guarantee safety. Q. Will stopping almonds fix my chronic condition? Answer. Avoiding almonds may reduce a trigger or aggravator, but it's rarely a cure by itself. Work with your healthcare team to assess all factors and to monitor labs or symptoms over time. Q. Can I take tests to find out if I'm allergic or sensitive? Answer. Yes, an allergist can perform skin testing or blood tests for specific nut proteins. For digestive problems, a gastroenterologist can recommend stool tests, imaging, or other diagnostic steps. For thyroid concerns, standard blood tests for TSH, free T4, and antibodies are the usual starting point. As we wrap up, one practical plan you can follow if you suspect almonds are an issue. Step 1, stop almonds for 2 to 4 weeks. Step 2, keep a simple daily log noting symptoms, foods, and timing. Step 3, maintain hydration and your regular medications. Step 4, bring your log to a clinician to plan tests and guided reintroduction if appropriate. This approach is low risk and information-rich for a clinician to interpret. Finally, a word about perspective. Food choices are deeply personal. Almonds have real benefits for many older adults, and giving them up is not always necessary. But older bodies are often less forgiving. Slower kidneys, changing thyroid function, shifts in gut microbiota, and an immune system that may react differently. Small foods can have big effects. That's why paying attention to symptoms and seeking medical advice is empowering, not fearful. If this video was helpful, please like and subscribe to Ageless Vitality. Share this with a friend or family member who snacks on almonds, especially if they're over 60. And if any of the 7 symptoms we covered sound familiar, make an appointment with your doctor and mention almonds in your diet. Then come back and tell our community what you learned. Your experience could help someone else spot a hidden trigger. Thanks for watching. Be safe, listen to your body, and stay curious about what works best for your health as you age.